In 2010, Haiti suffered a big earthquake. I think it was 7.0 on the Richter scale. And it was devastating for a couple of reasons. It's the poorest nation in the Western Hemisphere, and the infrastructure is really poor. The buildings don't have codes for earthquakes or anything like that. So when the earthquake hit, I mean, everything just fell apart. And then being economically poor, they really don't have the infrastructure to respond to any kind of emergency like that. They don't have ambulances and fire trucks. They don't have construction equipment all over the place. So it was very difficult for them to respond to that. So one of the first responders, if you will, to the situation was a medical team from Forest Park Medical Center. They went down to provide medical assistance in evacuating people, triaging people, and of course providing treatment, bringing doctors and nurses and supplies and equipment. That, in conjunction with one of the charities down there, turned into a regular visit where with Sacré-Cœur, which is the hospital down there, we would send a team and participate in surgeries on a regular basis. They would get patients that needed surgery ready. When the team arrived, they'd spend a week basically operating day and night to treat the cases that otherwise would have been too complex to treat in Haiti. So in the United States, we have a very robust system. It's very refined. There's safety protocols everywhere. Everything's disposable, so nothing gets reused. But in Haiti, it's the polar opposite. You're operating in a hospital that's an open air hospital. There's no air conditioning. The one air conditioner that is in the hospital is in the operative suite because under gowns and stuff it gets very hot. But it's a window air conditioner. The air's not filled. The instrumentation is very basic from the 1960s. Everything that they have is something that's been designated from a first world country. Well, this is a great opportunity to do what doctors really want to do. I mean, this is why you become a physician, because you have this overwhelming compassion. Anytime you see somebody that is hurting or is sick or is in pain, you want to help them, no matter what it takes. I mean, sometimes it becomes a downfall, but in this situation, you're able to go to a country and really give them something that they really never had access to. And in 100 years, they probably wouldn't get to it because it's such an economically poor country. I mean, when you go there, you see it's open sewer systems. The water they get out of the mountainside basically running down, and who knows whether it's clean or not. Again, the infrastructure is terrible. The buildings are half completed. There's no disposal system. Trash is everywhere, and it may not have been like that before the earthquake, but certainly it is now. They have basically paralyzed all the infrastructure to the entire country. We're able to go in there and just help with those situations, using the expertise that we have. Well, Forest Park has really been, I think, a leader in helping out. When this disaster occurred, of course, there were other hospitals that sent back teams, and there are other hospitals around the United States that sends teams as well. But in the Metroplex, Forest Park has been the one that's routinely gone back to help out, to bring supplies, to lean on our vendors who have been very helpful in when we upgrade our equipment, for instance, we can take that and use that for the Haiti missions. It's shown a remarkable sense of leadership and a remarkable sense of the responsibility that it is to be in the healthcare field for Forest Park to go down there and participate the way they have, not just initially, but on a regular basis.